When people have had treatment for cancer, it's really common to have struggles with their sex life, and we want to help people navigate those changes. So when we think about sexual well-being, we think about three areas. We think about sexual identity, sexual function, and sexual relationships. So sexual identity is about how we express ourselves as sexual people in the world. It's about how we want people to see us as sexual people, but also how we feel in ourselves. Sexual function is about those physical changes that have happened after cancer treatment. So this might be lubrication for women or changes in orgasm for women and men. It might be about erection problems and changes there. And a lot of times it's also about comfort around sexual intimacy. And then lastly, our sexual relationships. So this is our partner or partners that we want to be having sex with. Those changes can be difficult to navigate, especially when you've been navigating a whole lot of other changes as well. Some people want to get back to what they had before, but things have changed. And so we need to discover what this new body looks and feels like, but also how you turn up in the world, so that sense of identity. So those three areas, identity, function, and relationships, have all changed. Potentially one changed more than the other, for example, those physical changes, and therefore they're deeply linked. And understanding where the changes have happened and how we might recover from them or adapt to those changes is usually a really helpful way forward for people. So a lot of people will, after their cancer treatment, will discuss this feeling of loss. This sense it's another thing that I've lost to this cancer journey. They feel unsure about talking to their partner about how their body has changed and what's different now. And also a disconnection with their own bodies, which can be really frightening, overwhelming, daunting. And these are the sorts of things that we want people to get help with. It can be challenging for people to talk to their clinicians about these changes. Sometimes people don't feel that sex is important, or they worry about what they might be experiencing, or they're worried about a judgment. This can relate to sexual orientation, the type of sexual acts that people want to enjoy. And it's really important that actually we do ask some of those questions. I've certainly experienced people that have made assumptions about what is possible now after their radiotherapy treatment, or what is possible after the surgery that they've had. And actually by asking these questions, this can sometimes really help people to navigate those changes to a more pleasurable and enjoyable sex life. For most adults, they have navigated other changes or disruptions to their sex life at some point through some sort of life change, and therefore just really want to encourage people that actually thinking about how they might have navigated these changes before, you can start to engage in some of those things that help people get back to a more pleasurable and enjoyable sex life. So when people think about sex and sexual acts, they're often thinking about the type of sex that they're having, and that usually involves some sort of performance. So this might be about having receptive anal sex or penetrative vaginal sex, and needs certain elements to make that work, and with pleasure being associated with orgasm. That isn't necessarily a helpful frame for when you're discovering something new, or when you're having differences in the kind of sexual function that you've experienced, and also in that communication. So we talk about reframing it into a sense of presence and a sense of pleasure. So what am I enjoying now? Who am I enjoying it with? What communication can I have that might help to facilitate something that feels more pleasurable? I encourage people to start with small steps of own self-discovery. So taking time to explore your own body, to explore what feels good for you now. Start by thinking about your relationship and what you want to communicate, being open and honest, having some curiosity about that journey with your partner or partners. Sex is adult play. It should be playful, it should be enjoyable, but often that is disrupted in some way. So getting back to that kind of playfulness, that curiosity and that kindness is the way forward.